Officer in charge of the Department of Health, Maria Rosario Vergeire, announced on Tuesday that she is ready to assume the role of secretary, a position that has been open since the beginning of President Ferdinand Marcos Jr.'s administration. To tell us more, here's Zacarian Sarao with his report. Zach?
Yes, Neil, after several months of the Department of Health not having its own secretary, Officer in charge Maria Rosario Vergeire earlier said that she is now ready to assume the vacant position. In a press briefing, Vergeire, who is basically the DOH acting head as the department OIC, said her experiences connecting with diverse groups and Filipinos on the ground had made her realize opportunities to implement DOH reforms. She stated that even despite past hesitations, with the present state of the current health system, it is now, quote-unquote, the appropriate time to help the country. Vergeire, however, clarified that she will have to discuss this matter with President Ferdinand Marcos Jr. first, quote-unquote, if and when that will be his decision. Marcos had previously maintained that he only plans to appoint a health secretary once the COVID-19 pandemic in the Philippines normalizes. In the same media briefing, Vergeire also announced that the DOH is expecting the initial doses of bivalent vaccines by the end of March this year. Bivalent vaccine is a type of vaccine that targets specific variants of COVID-19. She said this was made possible after the DOH finalized the commitment of COVAX, one of the manufacturers of bivalent vaccines, to donate the said doses to the country. Neil, apart from COVAX, Vergeire also said that the DOH is now coordinating with other countries offering bivalent vaccine donations. One country already confirmed its commitment, but is still in the process of signing an agreement with the DOH. Back to you, Neil.
Zach, I want to go back to your story on OIC Vergeire. So that's the question here. So what is President Marcos' reasoning for not appointing a health secretary despite him being in office already for more than 6 months? Because critics argue here that the pandemic itself should be more than enough of a reason for President Marcos to appoint a health secretary so that we can address this as soon as we can.
Well, Neil, President Marcos had previously implied that not appointing a health secretary is one of the government's courses of action to normalize COVID-19. It can be recalled that Marcos said that he would wait for the COVID-19 situation in the country to normalize first before he appoints a health secretary. In fact, Marcos previously said that ideally, it should be the time when the government no longer treats COVID-19 as a public health emergency, but rather quote-unquote, something that we will have to manage forever like the flu pneumonia. Despite this, experts and lawmakers have repeatedly urged Marcos to appoint a secretary or at least appoint Vergeire, as her title of OIC limits her ability to make major reforms or decisions within the DOH. House Deputy Minority Leader Franz Castro, for her part, said that Marcos's move not to appoint a health secretary shows that the public health is not a priority of his administration, even amid the COVID-19 pandemic.
Yes, because there are certain tasks really that only the secretary of a particular government department would be able to do. That's Zacarian Sarao reporting live.